We had a really great guest last week, and we had such a response from him, we wanted to bring him back. Matthew Moore with InnerScope Hearing Technologies with us in studio. Matthew, how are you, sir? Great to see you.
I'm doing great. How about yourself?
The reason that this was, first of all, they are a publicly traded company under the stock symbol INND. So that's number one. Number two, if you go to their website, innD.com, you'll see all the information you'll ever need to know about this company. But one of the interesting parts of this thing that Matthew brought up, and he's sort of the spokesperson for this industry, is there's 50 million people in the US. 50 million, that is roughly 20% of us.
Correct.
That have a hearing problem. Matthew talked about that because I think that's the thing that most people don't realize is there's a bunch of undiagnosed people that can't hear.
Correct, yeah. There's only 8 million people currently being treated for hearing loss right now, with about 42 million not being treated. And that's traditionally because of pricing and accessibility as being the main factors, and the awareness about hearing loss and how hearing loss affects every part of your life.
So talk about that. Is this, so, we were told as kids, turn the amplifier down, turn the stereo down.
That's right.
And then in radio business, we had headphones on.
Oh, those were the best when they first,
Right. So, but is this pandemic overall with the whole population, or is there certain segments that are worse than others, or should we all be keeping an eye on this stuff?
Well, actually, it affects pretty much everyone. You have age-related, you have noise-induced, you have industry-related. A lot of steel workers, iron workers.
I can imagine.
The police officers, first responders. A lot of these people are affected by hearing loss. But pretty much anyone over the age of 65 is about 1 in 3 have a hearing loss.
Yes.
No kidding.
Yeah.
And it's a slow, is it slow or it varies? Some people, it's like the next morning you just go, oh, what the hell happened?
Well, actually, that is actually more of a lot of times is from if you have a loud explosion or loud something by your ears.
Yeah.
That could happen. Or these days, medication. It's called ototoxicity. Medication, Tylenol, ibuprofen. At home, there is thousands and thousands of drugs. That's the reason why, actually, a big win for our industry a couple years ago was Cialis and Viagra actually putting those warnings. If you've lost any vision or hearing right away, please stop medication, go to your doctor.
What a great scenario, though, on Viagra. You can't hear a thing.
Doesn't matter.
Doesn't matter.
Anymore. Hey, so with respect to this, the technology side, which is what you're the expert in, and InnerScope, talk about that. Are we keeping up with demand here? Because before, you put a cone in your ear and said, right? Even my own father, who's 90 years old, has a hearing issue, and he's even with his hearing aid, as he gets older, it's getting tougher. Is technology keeping up with demand on this?
It is. There is a lot of technology increases, generation. You're talking every 2 to 3 years, huge advancements in technology. But one of the biggest things is it's about still proper expectations. Yeah. Hearing aids are just that. They're aids. They help you hear. It's not like corrective lenses. When it comes to glasses, you put them on, you can see. Take them off, you can't see. Right. These, they can only aid you. So every single year a person goes being untreated, it takes about their brain 1 month to adjust to hearing before they start hearing better again.
So that's kind of because your brain just says, well, nothing's coming in, so I might as well shut this part down for a while.
Correct. Exactly.
Wow.
Yeah. And so that's one of the biggest problem is that people come in, they put one hearing aid in, and after about 5 minutes are like, oh, I'm not hearing properly.
Right.
And then we have to teach them and counsel them to give it a shot. One of the also big concerns is what they do is that they, when they put them in, they're like, well, what's that noise? Oh, it's the refrigerator running. Well, I don't want to hear the refrigerator running. Right. Well, no one wants to hear the refrigerator running.
Because they're too sensitive.
Well, yeah. Because what happens? They haven't heard the refrigerator in 10 years.
Right.
So, or the air
What's
vents.
that? Well, it's my ex-wife.
There you go.
So the leading cause of hearing loss in this country, I'm assuming, is noise, right?
Noise induced, but then also age. Age is one of the biggest ones.
Where does nagging come in on the?
That's called selective hearing.
Selective hearing. That's right.
That's right. But the try I'm trying to make is that would mean that industry wide, guys that are hammering concrete every day are more likely likely than people that are working in the library.
Oh, exactly. And then that's the reason why, OSHA and a lot of workplace environments have really started to get involved in first responders, the military, you name it. They've really started getting involved with hearing protection as being a big thing, because workers' comp cases is huge.
It's cheaper to buy the baggage handlers a couple of good headphones than it is to treat them the rest of their life.
Exactly.
For tintinnabulation.
Yeah, Matthew
I knew
Moore,
I'd get it in.
Matthew Moore is the CEO of InnerScope Hearing Technologies in studio here with us. Unparalleled experience, disruptive innovation. Stock symbol INND. You can go to INND.com. What's interesting is Johns Hopkins University did a 12-year study. I think you told us this when you were here last time, talking about untreated hearing loss is a contributor to dementia.
Correct.
Right?
Dementia and Alzheimer's. Yeah, because the brain, you have to use it or lose it, your brain starts to atrophy. So that's the reason why is that you're 5 times, if you have an untreated hearing loss, you're 5 times more likely to get dementia or Alzheimer's.
Scaring me, man.
Yeah, it's.
But here's the deal, though, is that this is not just people above the age of 60.
Correct.
There's plenty of millennials that have a hearing loss.
Absolutely.
And
You're
I'm
telling
assuming.
me.
I'm assuming.
My son won't listen to a word I say.
Hey, everybody. I think, though. Listen, I'm going to keep you here for a second.
Yeah.
We're going to keep him over. We want to talk about his products.
Brought
I also
some
want to
stuff.
talk about the fact that only 1 in 5 people that actually have a hearing aid actually wear the dang hearing aid. So that's so it comes down. It comes down to for all of us. It comes down to not only just understanding what's out there, but actually being compliant with what people like Matthew.
Not only that, great Christmas gifts.
There
Thank
you go,
Matthew.
Matthew Moore, InnerScope.
I'm using it.
INND.com. Stand by. We're going to get some more of this. We're going to talk about actually what these guys make and how you can get involved. And if you're experiencing hearing loss, Big Biz Show, BigBizShow.com. Stand by. Matthew Moore's here. Unbelievable.
Yeah, look what he brought.
Your whole
too, some
family,
stuff.
you've got, what do you got, like 60 years of experience in this
more.
business. InnerScope Hearing Technologies is the name of the company. INND is their stock symbol. They are publicly traded. But the reason we wanted him in here is we had such a big response after he was on the air, because he's it's not just about a great company. It's about the fact that he's turning into this spokesperson for this affliction, for lack of a better word, and this industry. So talk a little bit about what you guys create. So we've got some stuff on the set here, and I'm seeing what looks like standard hearing aids here, right?
Correct. Yeah.
The Alpha 5R.
Yeah. Yep. Actually, these are our 2 best products that we're actually on Walmart.com right now selling.
Both of them.
Both of them with 5-star ratings from Walmart customers right now. Basically, these devices right here are devices that would cost, if you went to a normal audiological office, they would cost around they're right there. Would cost about $4,000 to $5,000 a set. Yeah, $4,000 to $5,000 a set, and
a little over my budget.
Yeah, and we
I
sell
heard
them.
you on that one.
Yeah, and we sell them for as low as $1,000 a set.
Oh, okay.
Which still sounds pricey.
How do you do that?
Basically, what happens is that we're the direct manufacturer, so we're offering manufacturer direct pricing directly to the consumer.
Now, what if someone does have $1,000? Does insurance cover that stuff?
Insurance, most insurances do not cover hearing aids. They do have minimum level benefit, and if they have minimum level benefit, they can use these as a reimbursement for their health insurances.
Why in the world? See, this is like, so we raise money for the Challenge Athletes Foundation every year, and we're going to hit you guys up for several $1,000s for service. This is how we do it, by the way. We get people on the air, and then we make them commit. But it's a fantastic organization. We've raised $150,000 for CAF, and it's people that are born with birth defects, or they get their legs blown off in war, or they get a motorcycle accident. Insurance covers if you get your leg cut off. Insurance will cover a walking leg. Okay. But if you want a blade to run, or a piece of athletic equipment, it's considered a luxury. Insurance doesn't cover that. That's what CAF does. Much like this, insurance doesn't cover this
Correct. It does not, unless it's a workers' comp case, which is, that's more of a liability issue more than anything else. Insurances do not cover hearing devices. But actually, that's one of the things that we just recently launched, our FHAHearingAid.com and HSAHearingAid.com, that you can use your flexible spending accounts and your health savings accounts to actually buy hearing devices.
Okay.
You can even use that money even on Walmart.com.
Now, you have to change the laws or something about that, or just...
No. It's there. No one knows about it.
Well, that's what we're telling them.
Exactly, and that's the reason why HSA, they has like $19 billion in assets right now across this country, and not many people are using these funds.
I think I know why you're selling so many.
You know why?
Volume.
This volume. Hey, before we let you get out of here today,
Yes.
talk about the tinnitus project a little bit.
So right now we're in an FDA clinical study right now. We're actually getting subjects. We're actually enrolling subjects
I'll
right now.
sign up. Test me, man.
Exactly. We're actually enrolling subjects in our 3 InnerScope clinics right now.
Okay.
In the Sacramento and the Bay Area.
That's gonna take
and so this right here is actually a prototype device that we're
Yeah.
actually using for the FDA study. But then we're actually in the process of designing our complete in office.
And that I find out is like a blood stimulator flow.
Yeah,
something.
so what it does is that
Nailed it.
Yeah, nailed it.
Shut up.
So
Both of you. It's my show.
So basically, what it does is that it increases your blood flow, and actually, by doing that, it actually starts helping your system to hear better.
Good.
And that's what it does with the tinnitus is that it's not a cure; it's a treatment for the device.
Okay. So and this is this on the market yet, or is that still being tested for the market?
No, this is still being tested for the market.
Okay.
We're still in the FDA clinical process.
Well, lend me an ear.
There he goes. Matthew, thanks. We're going to hear more about. I mean, Matthew is going to be on with us as our expert in this industry. We're going to spend a lot of time. He'll also be on America Trends with Amy Fuller. Watch him on that today.